Are you planning to get pregnant in the next 6 months? Well, congratulations on making the decision, and then also I applaud you for taking the time for thinking ahead and trying to plan a future roadmap for yourself to put yourself in a good footing for your future pregnancy. This is Dr. David Kim, and we're going to go over some actions and steps you can take that will put you in a good place for your future pregnancy and put you on a good roadmap. The first thing to do that I recommend all my patients is that you schedule an appointment with your OB/GYN doctor. This is especially important, I would do right away, because in some parts of the country it might take several months before you can even come in to see your OB/GYN. Having a preconception visit is really important and really helpful. Aside from talking about updates in your medical history and your family history, your doctor might get a lot of different lab tests and also imaging such as pelvic ultrasound. In terms of the lab tests, well, one of the things I always recommend to my patients is doing genetic carrier testing. So there's different types of genetic carrier testing, and a lot of them will check between 400 to 600 different types of blood tests to see if you're a carrier for any genetic diseases. Now, a lot of people are carriers for genetic mutations, and that's okay. That doesn't mean your baby's going to have any type of genetic disease. But if you are a carrier, you'd want your partner to be tested also to make sure there's no overlap in the different genetic mutations. And if there are, this would be a great opportunity to talk to a genetic counselor to develop some strategies. Some other blood tests that your OB/GYN might want to do is check for STDs or check for rubella and varicella to make sure you're immune to those diseases. The reason being is if you're not immune, then we'd want to give you the vaccination now. The reason being is we can't give you those vaccinations during pregnancy. And if you're not immune and you happen to be exposed to someone during pregnancy with those infectious diseases, then it can cause a lot of detrimental problems to your pregnancy. There might be some additional blood tests that your doctor might do. For instance, if you're not having regular cycles and if it seems like you might not be ovulating regularly, they might be checking blood tests for PCOS. They might check an AMH level, which is anti-Mullerian hormone, which gives us an assessment of your ovarian reserve, FSH, which is follicle stimulating hormone, and estradiol. Now, normally, whether or not there's a benefit for AMH is a little tricky. So the reason being is when we're talking about the short term, about getting pregnant in 6 months to a year, they haven't found a benefit in terms of AMH being able to predict your future pregnancy. So when they looked at women who had low AMH levels and normal AMH levels, they had the same probability of getting pregnant inside of a year. Now, it can make a difference, the AMH levels, if we're talking about trying to get pregnant longer than a year, because if you have a low AMH, it'll generally continue to decline. But I think where it can be helpful is if you happen to have irregular cycles or not ovulating regularly, I think it would be helpful to take a look at the AMH, because the AMH might give us an idea if you have some degree of ovarian insufficiency or very low ovarian reserve. Where this can be helpful is if you have a low AMH, and then in that case, we may not have you try to conceive for 6 months or 1 year. What I would probably recommend is after 3 months, you see a fertility specialist so you can get further evaluation. Some other common blood tests that we do are thyroid tests, just to make sure you are a normal thyroid, because it's very common actually in the population to have some degree of abnormal thyroid hormone, and that can affect your fertility. So we can easily correct that with some thyroid hormones. In terms of imaging, pelvic ultrasound is sort of our staple. We would probably do a transvaginal route for the ultrasound. And the reason we want to do this is if you happen to have fibroids or uterine polyps, sometimes those anatomic changes can cause problems with getting pregnant. And in some cases, depending on the individual situation, we might recommend surgery before you even try to conceive. The second thing that actions you can be taking has to do with nutrients and supplementation. Of course, I do recommend having a well-balanced diet and lifestyle changes that are healthy with good exercise, which I'll talk about a little bit later. In terms of the nutrients, we do recommend prenatal vitamins. I would make sure the prenatal vitamins have enough folic acid, which they generally do, which is 400 micrograms per day that you'd want to be taking. If you happen to be short or deficit in calcium or iron, then you'd want, or vitamin D, then you'd want to take those extra supplementation also. In terms of other supplements, CoQ10 might be something that you consider, and I would talk to your OB/GYN doctor. CoQ10 is an antioxidant. It actually is a naturally occurring antioxidant in our bodies, but declines over age as you get older, and also if you're on statins. Now, there's not a lot of studies and data on CoQ10 supplementation in humans. They did study it in mice, and they found that there was a protective effect against damages to the ovaries, where they intentionally gave some mice chemotherapeutic agent called cisplatin, and then another group with cisplatin and the CoQ10, and the CoQ10 had a protective effect. There's less data in humans about the effects of CoQ10 in terms of protecting the ovaries, but there is IVF data that showed that the pregnancy rates were higher in patients going through IVF that were taking CoQ10. Now, because CoQ10 is a supplement, has very low side effects or risks, it's something you might just want to start taking, have a beneficial effect on your ovary. In terms of diet, what I talked about was having a well-balanced diet, lean proteins, nuts, vegetables. I would avoid the 3 F's: fast food, fried foods, fatty foods. If you have to eat it maybe once a week, I probably would avoid sugars overtly. The other blood tests, I forgot to mention that we would check is a hemoglobin A1C to see if you're diabetic or pre-diabetic, because that can also affect your fertility and also increase your risk of miscarriage. The lean, well-balanced diets I talked about. I think Mediterranean diet is a diet that's really helpful for that. Thirdly is maintaining a good weight. So of course we talked about exercise and nutrition. In terms of exercise, I would consider doing exercise 3 times a week for at least 30 minutes, including aerobic and anaerobic exercises. If you happen to be a normal BMI of 25 or less, I think you're in a good position. If you're overweight, which is a BMI of 25 to under 30, then in that situation, definitely putting yourself on some sort of caloric restriction and a more regimental exercise program would be helpful. I think if you're under a BMI of 27, like 25, 27, sort of just barely overweight, I think a caloric restriction exercise probably is enough for you, and you just need to lose a few pounds, and that would improve your fertility chances. Now, if you're higher than a BMI of 27, or you're obese with a BMI of greater 30, BMI, by the way, is just your weight in kilograms over meters squared. If you're not sure what it is, you can just go online and type in BMI calculator and calculate your BMI. Now, if your BMI is 27 or higher, oftentimes you need a medication to help you lose weight. Now, 6 months is not a lot of time to be able to do that. The other thing is that you don't want to be on the GLP weight loss drugs while trying to get pregnant. So if we had more than 6 months, I would recommend optimally putting you on a GLP medication. That would be either semaglutide, trade name being Wegovy, or tirzepatide, with trade name being Zepbound. With 6 months, getting some weight off of you and then washing out the medication for 2 months and then trying to conceive. Now, if you have a firm 6-month timeline, then maybe you might be willing to find a doctor that would be willing to try the GLP drugs just for 4 months, because sometimes just losing a few pounds can make a huge difference in improving your fertility. Or just putting yourself on a very regimental caloric restriction and exercise program can be really helpful. So I'm very excited to hear that you're trying to get pregnant in the next 6 months. Something I forgot to add that you might want to do is do urine ovulation kits. You don't have to do it for the full 6 months, but you might want to do it just to check to see when you're generally ovulating. If you use the apps that are sort of the menstrual cycle apps, they might be okay if you're having 28-day cycles, but if you don't have exactly 28-day cycles, they won't be as accurate. So that's where the urine ovulation kits are really helpful. I hope that was helpful. Please write in comments if there's any questions you have, or if there's other things you'd like for me to talk about. And if this was really helpful, please subscribe. Again, this is Dr. David Kim. I'm really excited on your journey and hope that you put yourself in a really good footing and roadmap for your future pregnancy.